So when we start to look at trying to reduce the stress on hospitals, and the governor said that we have more West Virginians in hospitals with COVID-19 today than we've ever had before, and we start looking at saving lives and maintaining vital capacities, then we want to target the sectors that are both important for that capacity commitment that the governor has instructed us to make, and then start very quickly to start to accommodate the older people in our population. And so when you look at phase, and Jordan, I don't know if you can throw up the graphics, but when we start to look at phase one, and we look at generally in phase one, we are going to focus as the advisory committee to the Centers for Disease Control suggested in our first 1A, our most important category is hospital workers in acute care hospitals, and look at people who work around airways because they come into more contact with COVID-19. We look at our long-term care industry, and as Todd Jones just told us, that we are very aggressive with the governor's orders and commitment to focus on nursing home residents and staff, because these are the people that die the most frequently. And remember, we are immunizing a lot of our hospital workers and our nursing home workers, so we maintain those vital capacities. But we also recognize that people that work in hospitals and work in nursing homes that are following the appropriate precautions, the spread of COVID-19 in these facilities from a patient, from a person infected to another person inside the facility is actually much less common than people that catch COVID in their own homes. And so as we look at the targeted population, the nursing home population is very, very critical, the residents, because these are the people that account for 47% of our deaths. And then we focus on pharmacies. And the reason why pharmacies are so important to us, because the network of how we handle and pass off the COVID-19 vaccines in the state are from the hubs to pharmacists. And we're working with Krista Capehart, who's done a spectacular job for us, who works both at WVU and with the state pharmacy association. And we've created a whole network of pharmacists, and that's how we make sure that we are handling each vial correctly and that we are making sure that we're not wasting a single dose. So then when we go to phase 1B, then 1B is again, this community infrastructure, looking at EMTs, emergency medical personnel, looking at police, fire, public health officials working in local health departments, the National Guard that's supporting this effort. And in phase 1A and 1B, we will immunize all people irrespective of age. And let me just make one important point, that we are not just haphazardly selecting these people. We are working with governing associations, for instance, the West Virginia Hospital Association, to help delineate with the hospitals what the hospitals need, with the Long-Term Care Association to figure out what the nursing homes need, with the city and county, with the county and state officials, including DHHR, Bureau of Public Health, to figure out what we need to do for the people in 1B. So we're really following the governance of the overriding the umbrella organizations over these. Now, when we get to 1C, we are going to make a bit of a change. So as we look at other healthcare, which will include the remaining hospital staff and people that work in clinics and outpatient areas, people in home health, people in hospice and other areas, we're really going to focus on that group of people in the higher age groups, because we know that if we appropriately wear protective equipment, personal protective equipment, the spread of COVID-19 inside these facilities is pretty rare. But what we want to do is we want to make sure that we have that workforce, and particularly that we start to protect the people in that workforce that have the highest risk, as I mentioned earlier, of having severe disease or who could die from COVID-19 infection. And then we get to 1D, and we start to look at other people in the communities and other people in the state that are vital for our capacity and continue to deliver services. This will include people in the food industries, utilities, transportation, higher education, K through 12, And so as we look at this group, again, we'll initially focus on people 50 years old and over. And I should have added that for the 1B phase, we've also added dentists, because dentists have higher risk because they work right around the airways of people. So that's phase 1. And this phase is really meant, as I said, to be informed by the agencies that oversee these industry sectors and help us understand who these vital people are. But these different phases are not sequential, or not inflexible. It's not like we do phase 1A, then 1B, then 1C. So we're working very flexibly, because for some of these sectors, the over umbrella organizations might say, we don't want to send all these doses right at first. We want to distribute these doses over a few weeks, so we don't disrupt vital functions of these types of organizations. So there is a flexibility to this, but these are the priorities for phase 1. Now, phase 2, which the governor mentioned, we really want to start them focusing at the general population, and particularly the people that are older. So what the governor said, and what I recount as far as the science, we know people 70 and above account for 77% of the deaths that we have in West Virginia. And when you look at people in those age categories, their risk of dying versus 18 to 29 years old by the CDC is 220 to 630 times higher. So we really want to start to identify those people that are older, 80 and older, 70 and older, 60 and older. And then we want to look for people who have pre-existing health conditions. But instead of us trying to determine which pre-existing health condition is more important than another, what we're going to do is we're going to ask their healthcare providers to write an order to get them into this higher level category, so that we're very inclusive, but we're also selective, because we want to make sure that we're using each dose of the vaccine wisely. And we'll come out with more guidance about how we're going to do this, and how we're going to identify those specific people in these populations. In phase 2B, we're going to look at these other sectors that we started in the phase 1C and 1D, who are under 50 years old, and we want to immunize them. And then as we get to phase 2C, we're going to get to the rest of the population. And so as we start to look at this, the guidance that we had from the governor: maintain acute healthcare assets and capacity. And we do that by both immunizing the healthcare workers, but also trying to target our immunizations to the people that are likely to get the sickest, to end up in the hospital, and to die of COVID-19. And that's the other main directive, is save lives by the governor. And then by administering vaccine to these vital community, workers, whether it's first responders or vital utility workers and or people in the education field, and vaccinating those people in the higher risk categories first, I think we're able to meet the commitments of the governor, yet also stay within what Dr. Birx suggested we do. So thank you very much.